Please welcome back to the program Dr. Carrie B. Strom. Carrie, since the last time we've spoken, as far as the progression of this virus is concerned, are you surprised, not surprised, or is it about what you expected?
Well, it's about what I expected. Certainly, we didn't look at without the mitigation. It could have been disastrous. I mean, if you figure that half of the population would be infected in 6 to 18 months, you're talking about probably 160 million people, and then you're looking at if you have half of the population affected and you have a mortality rate of 1%, you're looking at a lot of people. So we're not close to that, and I do think the mitigation has helped dramatically. But the problem is going forward, Larry. What do we do? What do we do? How long do we mitigate? How long do we shut down the economy? Is the economic meltdown a price worth paying to halt, delay, and what is already amongst us? And those are the questions that everybody's dealing with right now, and I don't really think anyone really knows what to do. A lot of it is guessing and speculation because we just don't know, because we don't have a test that tells if somebody is immune to this disease.
Mm-hmm. Dr. Strom, when I hear the politicians and the other doctors talk about mitigation, is it that we're talking about delaying the spread of this virus so that we don't clog up our ER rooms, we don't clog up our IC units, as opposed to and buying time to develop more treatments and a vaccine? Is that what we're doing? We're simply trying to not clog up the system and therefore space out the number of people who contract and this disease? Is that what we're doing?
Yes. I mean, look, the point of mitigation is twofold. Number one, not to spread the disease to people that will get very bad consequences from contracting this. Older people, people with comorbidities, people with hypertension, diabetes, people that are obese, people that are sick. I mean, we just don't know. So that's one thing. We don't want to get them sick. And the second thing, could you just imagine that people are spreading this disease all over the place and everybody gets sick and you just don't have enough hospital bed, ventilators, personnel, personal protective equipment to go around? It can be disastrous. So I think the mitigation is for twofold, because I told you before, we don't have a vaccination, and the only thing you can do is mitigate at this point in time. The second issue is overwhelming the hospital system, and I do think the social distancing is working, but what price are we paying? Now, let me tell you one other thing that maybe people haven't thought about. In my practice now, we do a lot of video conferencing. I know you have a family member who's a doctor, and you mentioned that she was doing that as well. But I think people are now afraid to go to see the doctors and are afraid of health care. And you have to remember, there's still a lot of disease out there besides just COVID-19. There's heart disease, diabetes, hypertension. I think we're going to see a really bad fallout of people neglecting themselves for the fear of going to the doctor during this pandemic.
Dr. Carrie Strom is my guest. Dr. Strom, George Stephanopoulos has contracted the coronavirus. Here's what he said about his symptoms or lack thereof.
I also learned over the weekend that my test came back positive for COVID as well, which is really no surprise given the fact that I've been here for a couple of weeks. But I'm one of those, I guess, cases that are basically asymptomatic. I've never had a fever, never had chills, never had a headache, never had cough, never had shortness of breath. I'm feeling great.
My question, Dr. Strom, is how many people do you think are like George Stephanopoulos? They've had it, had no real symptoms, walking around, perhaps giving it to somebody else, completely oblivious.
Well, that's the problem. That is the problem. I mean, it's been all over the press lately, all over the news, that the person who carries the virus without symptoms can be a transmitter to other people. And the recipient of the asymptomatic transmitter can have a catastrophic event. That is the real issue. Now, are those asymptomatic people not going to transmit? People that are asymptomatic are less likely to transmit than somebody with symptoms. If someone's coughing and sneezing, they're more likely to transmit that somebody is asymptomatic. But the asymptomatic transmitter is still out there. So are they going to transmit it to somebody who's going to fare poor with this virus? The other question is, are these people asymptomatic developing what we call herd immunity?
Mm-hmm.
That's when 50 to 60% of the population gets immune just by being around. I mean, I have many patients in the past coming into the office and will be screened, let's say, for instance, for hepatitis A, but they've never clinically had it, but they were exposed. That's herd immunity. We really want that. The problem is it's a price to pay. You have these asymptomatic people, later will become immune, but can they transmit in the interim before they develop that immunity? And the only way we're going to know that is with an antibody test, which really is going to be the key to treatment of this entire pandemic.
My guest is Dr. Kerry Strom. We're taking your questions at 888-971-SAGE, 888-971-7243.